My objection here for the second phase is definitely understood by you. What do I want to do? I want to remove something. What do I want to remove? Okay, because that does not make sense actually. CRH has to be removed here from here, okay? And what we do is that we keep mainly the estrogens and the prostaglandins, okay? Okay, all right, so we'll remove it. We are not considering it. Prostaglandins, again, you have to be very clear about which prostaglandins are we talking about now. Utotropins, they are causing the growth and sensitivity of the uterine muscles. So which prostaglandins? Contraction. Yane, can you give me the name? F2 alpha. Okay, it's not prostacyclin. It's not PGI2. We are talking about F2 alpha. These are uterotropins or uterotropic hormones. Yes, sir. Motors.
The same as I2?
I2. Okay. Other name of I2 is prostacyclin, inhibitor, relaxant. Okay. Right, Shabab? So, this is it. After that, there is stimulation phase. Stimulation phase is the real drama. It means the delivery of the baby, the whole process of labor mechanically. Everything is stage 1, stage 2, stage 3. It means you need, definitely those hormones which are causing true contraction of the uterine muscles, and for that on top of the list you have number 1 oxytocin and supported by other hormone which is prostaglandin. So oxytocins and prostaglandins will work together in this phase, okay? Last phase, involution. When you are contracting the uterus, you are decreasing the bleeding. You know, the bleeding and the discharge from the uterus after delivery of the baby, it's not that discharge is stopped in 1 day or 2 days or 3 days. This bleeding continues for many days, sometimes 15 days, 20 days, up to 40 days, slight bleeding or leakage continues, okay? Because uterus is repairing itself. So some bleeding is going on. Oxytocin is working at that time also. Oxytocin has a very powerful effect, a high effect just after delivery, because it has to contract the uterus and to bring the size as small as possible. And other proteins like thrombins and some clotting proteins, they also increase so that they will try to coagulate and control and stop the bleeding inside the uterus also, okay? Look at the graph, okay, like this. Stimulation. So myometrium is maximally active in this area, okay? The activity is increasing. You know, from the activation phase, the myometrial activity is increasing, okay? This activity is not maximum in the beginning or in the middle of the labor process. At the end of the delivery of the placenta, still you have a very high myometrial activity, and this goes to the peak, and this high activity is maximum in the involution phase, trying to contract the uterus and keeping the tone of the uterus very high, tight, okay, so that the bleeding is minimized. Okay, now we are done with the phases. Come on, okay? I'm not doing anything for the phases. You will read it yourself, what is written here. Look at this diagram only. Look at this diagram only. If there is a phase 0, how is the communication between the smooth muscles? Just tell me. Less or more? Less. Less number of gap junctions are present because hormones are favoring less number, okay? If I change the slide and I do it like this, what has happened to the number of the gap junctions here? Increased. Multiple connections have been established. Now they are very well connective. The connectivity is very high and the excitability is now increasing. The sensitivity is now changed. This is happening in the phase of activation, the next phase, okay, because estrogen is dominant now, okay. Phase 2, definitely it's the process of the labor controlled by the oxytocin, prostaglandins, and some other cytokines which are locally produced by the uterus. Okay? After delivery of the baby, last phase, involution phase, when the uterus is contracting, okay? I said up to 6 weeks of delivery, this process of involution continues really. And whenever mother is feeding the baby, this process of involution is more quick in those mothers who breastfeed the babies. Why? Okay? All right? What else? But so far we have not seen, Abdullah, we have not seen any role of prolactin. We did not use the word prolactin in our discussion so far, isn't it? Okay? What else could be there? Progesterone. If progesterone is there, progesterone will inhibit the uterus and it will allow the bleeding and it will not allow the involution. Uterus will remain relaxed. You want the contraction of the uterus, powerful contraction. Oxytocin, my dear boys. Oxytocin is the hormone which is causing the milk to come out of the breast. Pumping of the breast actually is done by oxytocin, not prolactin. Prolactin is just making the milk, secreting the milk. The final job of coming out of the milk is done by. So oxytocin has a double function. Number one, it is giving milk to the baby. And second, at the same time when oxytocin is released, she's feeding, the uterus goes into, so mother has a feeling, whenever she's feeding the baby, she feels some tightness, slight tightness inside. Why? Because the uterus is showing some contraction. Okay?
After we finish,
Yeah.
I want to take a picture.
For?